Hello, my name is Karn Log, and welcome to Cancer Logic. Today I will be talking about the treatment of cancer. The most common thing that people think about when they think about how to treat cancer is chemotherapy. But chemotherapy is actually a pretty generalized term, and there are really different and vastly various ways that we are now treating cancer with chemotherapy. So going back to what is cancer, cancer is, again, rapid, uncontrolled cell growth. And so when we talk about chemotherapy, the most common thing that people think about is actually what we call cytotoxic chemotherapy. Because as cancer cells are rapidly dividing cells, what we can do is we can give you cytotoxic chemotherapy or drugs that basically kill cells that are growing rapidly. The problem with that approach is that, yes, as we're killing cells that are growing rapidly, it kills cancer cells very, very well because they're growing fast. But the problem is it cannot distinguish between good cells and bad cells. So unfortunately, a lot of good cells that are dividing will also be destroyed as well. So that's why, again, the one common toxicity is hair loss. Because your hair is constantly growing, and as chemotherapy is affecting the cancer, such as breast cancer, can have a tendency to actually destroy the follicles of the hair as well. So your blood cells, your white blood cells, have to respond to any infections that you have. And so the white blood cells are actually a very common side effect of cytotoxic chemotherapy as well. And so cytotoxic chemotherapy is just generalized destruction of rapid cell growth. But we've really gotten away from cytotoxic chemotherapy now. And so, recently we've actually started to develop more targeted therapies. The first category of targeted therapies is actually a category called tyrosine kinase inhibitors. So if we think about cells as rapidly dividing, what we've started to see is there's actually little switches that have been activated that have led cells to grow, and those switches, unfortunately, have not been able to turn themselves off. So as these switches are turned on, it leads to cell growth, and as they're supposed to be turned off, they're supposed to stop, but that, again, switch has been lost. So with tyrosine kinase inhibitors, or oftentimes they're abbreviated as TKIs, these are actually drugs that are looking for these specific switches. And sometimes these TKIs can actually turn off those switches. The most common example is a drug for a disease state called chronic myelogenous leukemia, or CML. And so what we've been able to discover is that there's a specific gene called the Philadelphia chromosome. And we've been actually really done a good job of turning off that Philadelphia chromosome. The first tyrosine kinase inhibitor that we saw was this drug called imatinib. And we've been able to actually develop second and third generation drugs that have targeted that same exact mechanism. And have really changed CML from a disease where inherently we knew that patients would actually pass away after a few years to a disease where patients are actually living out their life and almost basically treating it like a chronic disease. So tyrosine kinases are another form of systemic chemotherapy that we're using. Another form of chemotherapy that we're using is a group of drugs called monoclonal antibodies. These two are also very targeted. So what we've seen is that, a lot of times on the membranes of cells are various markers and proteins that we've actually been able to target as well. A common example that we've seen is this protein on the surface of breast cancer cells called HER2. Okay, and so what we've seen is that there's a subset of breast cancer patients that actually had very, very aggressive breast cancer, and we were able to discover that this protein called HER2 was the reason why these breast cancers were so aggressive. But we've actually been able to target that protein as well. And so there's a drug called Herceptin, and actually another drug called Perjeta that was developed that specifically targets HER2. There are side effects that come along with that as well, as that your heart is also something that expresses HER2. So it's not a perfect set of drugs by any means, but also at the same time a more targeted, because again, Herceptin only attacks cells that express this HER2. So it spares side effects of other things. So you don't get the hair loss, you don't get the nausea, vomiting, you don't get the low white blood cell counts, increased risk of infections. And so we're developing more and more effective therapies with less and less side effects and toxicities. But again, all of these are actually considered chemotherapy because, again, they circulate throughout your entire body. The newest and most exciting form of systemic chemotherapy is this new realm of therapies that we are calling immunotherapies. What we actually all know is that all of us unfortunately develop cancer cells. And that's a very, very normal process. But the other part of the process is that our immune system is usually able to find and identify those cancer cells and destroy them before they really start to take a hold of your body. What some cancer cells have been able to do is find a way around your immune system in order to start its cell growth. So with immunotherapies, we're really looking at activating the immune system and sometimes just basically taking off the brake so it doesn't shut down as it normally should. And as it activates and revs up your immune system, it actually does then fight the cancer itself. And so chemotherapy in general has drastically changed from the generalized cytotoxic chemotherapies that are really just generalized and killing every cell that's growing abnormally to more targeted therapies like tyrosine kinase inhibitors or TKIs, to monoclonal antibodies, examples include Rituxan and Herceptin, to this new realm of therapy called immunotherapies. And each of them are all unfortunately associated with side effects, but not the same generalized side effects that we typically see with the cytotoxic chemotherapies. So it's still important to talk to your cancer provider about different treatment options. But again, we're definitely getting into an exciting realm that we have never been able to offer patients before. So again, hopefully that clarifies some of the new treatment options that are available for cancer. Again, my name is Karn Log. This is Cancer Logic. Again, feel free to comment on any future videos that you would like. Feel free to share this video as well with any family members that you feel that this would be helpful to. And I appreciate your time and feedback, and thanks again for watching. Thank you.